Gallstones is an important topic in pathology and commonly it is asked in our exams. Gallstone is also known as cholelithiasis. Cholelithiasis that means gallstone. So what are gallstones? We need to see that. So gallstones are solid conglomerates of different sizes made up of cholesterol crystals, resin, calcium, bilirubinate and proteins forming inside the gallbladder. So why gallstones are called as gallstones? Because they are formed inside the gallbladder and they are solid conglomerates. So this is basically a definition. In simple words, we can say they are solid stones. They are stones of which can be of different sizes, and what are they made up of? They are made up of cholesterol crystals, resin, calcium, bilirubinate and proteins. And where are they made? They are made inside the gallbladder. Okay. Next we see what are the types of gallstones. So particularly we have two types of gallstones, which is cholesterol gallstones and pigment stones. So what is the difference between these two? So in cholesterol stones it contains crystalline cholesterol monohydrate, whereas pigment stones they are made up of bilirubin and calcium salts. Okay, so cholesterol stones, why are they called as cholesterol stones? Because they contain cholesterol monohydrate. Why are pigment stones known as pigment stones? Because they contain a pigment which is bilirubin along with calcium salts. Now these pigment salts can be of two types further. They can be black pigment stone or brown pigment stone. Black pigment stone, they are made up of calcium bilirubinate, calcium carbonate and less than 20% cholesterol. Brown pigment stones are made up of calcium bilirubinate, calcium soaps of fatty acids and cholesterol. So basically what we can remember is that black pigment stones and brown pigment stones both consist of calcium bilirubinate, calcium and cholesterol. Only difference is that in black pigment stones there is calcium carbonate, whereas in brown pigment stones there is calcium soaps of fatty acids. How we can remember? Like black pigment stones, they contain calcium carbonate. So carbon is black in color. That's why they are calcium carbonate is a constituent of black pigment stone. Then what are the risk factors for the gallstones? So basically we can remember it by 5 F's. What are the 5 F's? Fair, fat, female, fertile and familial. What is the meaning of fair? Fair means generally the white population. Fat, obese people. And female gender. Fertile, anyone who is fertile. And familial means someone who is having the family history. Okay. So first we now come particularly. First we see what are the particular risk factors for cholesterol stones, then what are the particular risk factors for pigment stones. That mnemonic was a general thing. Now this is specifically. Okay. So cholesterol stones. There are three main risk factors for the formation of cholesterol stones. First is increased biliary cholesterol. Second, decreased bile acids, and third, gallbladder stenosis. Okay, simple. Increased biliary cholesterol. If biliary cholesterol is more, there will be more cholesterol stones. Decreased bile acids. If bile acids are less, means the cholesterol is not being able to metabolize. So there will be increased formation of cholesterol stones. Third is gallbladder stenosis. So we all know if there is stenosis, there is no flow of something, then the content of that particular thing, they tend to come together and form a solid mass. So if there is a gallbladder stenosis, there will lead to increased formation of cholesterol stones. So in what cases do we see increased biliary cholesterol? Obesity, increased dietary cholesterol, diabetes, hyperlipidemia, female sex hormones, and any familial means family history. Obviously, someone who is obese, you can assume that he may be having increased cholesterol. Someone who take increased dietary cholesterol, he is basically having increased cholesterol. Diabetes, hyperlipidemia, you can relate it with increased cholesterol. Also female sex hormones and family history. Decreased bile acids in case of female sex hormone, in case of primary biliary cirrhosis, and mutation of CYP7A1 gene, or we can say mutation of the enzyme cholesterol 7 alpha hydroxylase. This CYP7A1 gene, it codes for the cholesterol 7 alpha hydroxylase enzyme. Where do we see gallbladder stresses? We see gallbladder stresses in case of pregnancy, and it may be due to any neurogenic reason or due to any hormonal reason. It's basically in pregnancy or neurogenic or hormonal reason. Okay. What are the risk factors for pigment stones? First we see for black stones, then we see for brown stones. For black stones, there is increased production of uncoagulated bilirubin. If there is increased production of uncoagulated bilirubin, it will lead to the formation of black stones. What are the cases in which we see increased production of unconjugated bilirubin, like chronic hemolysis in case of thalassemia and sickle cell anemia? Obviously, if there is chronic hemolysis, RBCs are getting rupture, they will lead to release of unconjugated bilirubin. And where do we see this chronic hemolysis? What are these chronic diseases like thalassemia and sickle cell anemia? We also see increased production of unconjugated bilirubin in case of Crohn's disease and maybe any unknown reasons. Brown stones. For brown stones, the risk factor is bistasis associated with bilirubin infection. Like with what kind of infections? Like E. coli infection, Clonorchis, and roundworm infestation. We all know if there is stasis of something, it will lead to stone formation. It will lead to a solid form. So, bistasis, which is associated with any bilirubin infection, will lead to brown stone formation. So, basically, what do we see? In today's video, we learned that what are gallstones? They are solid conglomerates which are made of different sizes. And what are they made up of? They are made up of cholesterol crystals, glycine, calcium bilirubinate, and proteins. Where are they found? In the gallbladder. What are the types of gallstones? We have cholesterol stones and pigment stones. Why cholesterol stones are known as cholesterol stones? Because they contain cholesterol monohydrate. Why pigment stones are known as pigment stones? Because they contain a pigment which is bilirubin and also calcium salts. Now these pigment stones can be of two types, black pigment stones and brown pigment stones. Both of these contain three similar things, which is calcium bilirubinate, cholesterol and calcium, except that in black pigment stone we have calcium carbonate, carbon black, okay? And in brown pigment stone we have calcium salts of fatty acids. What are the risk factors for gallstones? Like how can someone be at more risk for having these gallstones? So for generally these are 5 phenotypes, which is fair, fat, female, fertile and familial. Now specifically for cholesterol stones there are 3 reasons: increased biliary cholesterol, decreased bile acids and gallbladder stresses. For pigment stones, risk factor for black stones is increased production of unconjugated bilirubin, and risk factor for brown stones is bistasis associated with biliary infection. So that's it for today's video. In next video, we will see the pathogenesis of the cholesterol stones.